Good evening, everybody. On behalf of Mara, thank you everybody for coming this evening. What a fantastic space! It's the it was the Menier chocolate factory back in the 1870s, and now it's a Grade 2 listed building. And it's just, the space is right for the reason we're here tonight. And when you think about what Marduk's done with the book and how aesthetic it is and the content, and then you come into this space, we're in the right space for the right event. And I think to join that together just makes so much sense. You know, sometimes you see things where there's no congruence. We've got congruence tonight, so that's a beautiful thing. Thank you to Payman from Enlighten who sponsored this evening. Thank you very much indeed, sir. Front row. So to our guest of honour and our author, Marduk Praja, dentist, positive psychologist, CEO of Mind Ninja, and the author of the book that's around tonight. The book is available to purchase if anyone would like to. I got an advance copy, and we talked a little bit before about it, and I've got the mind flossing toolkit, but I had no idea the extent of what was going to be in this book and the way it was presented and the flow of it. So honestly, it's an amazing piece of work, and it's landing at the right time. I'm sure everybody agrees that mindfulness and well-being has been building as kind of a pressure cooker in society for the past few years, and it's been completely absent in dentistry. So well done for delivering something that is so needed in this world. So just to kick off, Marduk was very generous and gave her time. We talked on my own podcast. One of the things that came out from that was your own battle with being burnt out and kind of took you to the edge of depression. And could you perhaps just talk through, was that kind of the start point that got you into this world?
Yeah, absolutely. So back in 2015, 2016, I was experiencing burnout and depression. And prior to that, actually, I hadn't had any mental health challenges at all. So it was really, really tough to navigate this roller coaster of emotions and to sit with the discomfort of uncomfortable emotions and unhook from thoughts that were just not helpful for me. I didn't feel like I had those tools to navigate that period of my life, and I was really, really fortunate. Like, unlike many of my dental colleagues that feel so much stigma to seeking help, I had actually done a BSc in psychology as a student, and so I had this textbook knowledge of mental health, and I knew that psychological tools could make a difference, and so I didn't feel that kind of hesitation to seek help. And I found an amazing psychotherapist and went on this just amazing journey, really learning about how to regulate my emotions and become more self-aware, because it all starts off with that, just understanding, noticing our emotions and thoughts, and then really learning how to navigate that journey and to find that sense of meaning again, and that sense of happiness. And so it was really kind of a pivotal point for me in terms of my career, and it really spotlighted, I guess, the importance of prevention. You know, in dentistry, one of the key pivotal, I think, principles we're taught is that prevention is better than cure. But why don't we take the same approach when it comes to our mental health? And just like we exercise the body, like all of us understand about exercising our physical body and the muscles, we can take that same approach and really exercise our mind. And I think that's like a gorgeous way of thinking about it, because it's taking those intentional well-being actions that make such a big difference in not only reducing negative well-being markers like anxiety and depression and burnout, which we're going to delve into today, but equally as importantly, to really help us, find that happiness in dentistry, to feel more connected to others, have that sense of purpose and meaning, and accomplish those goals that really matter truly to us. That's also part of the wellbeing conversation. And so, that really troubling period of my life actually became such a gift, and I've grown so much through that journey. And it just, really kind of highlighted to me that what's really missing currently is there's such an emphasis on services at crisis point. So we're actually really fortunate in dentistry that we have a 24-hour helpline like Samaritans for us, like Confidential. We've got, we don't even have to go through our GP now to seek therapy. We can, directly find that route and get CPT sessions, which is amazing. But what we are missing are preventative, evidence-based psychological tools early on, and that's really my passion. To bring that to dentistry in a way that hopefully resonates and people take seriously. Just like we go on courses to do beautiful composites and whitening and do all this gorgeous dentistry, we need to actually give so much more importance to our own minds and our own well-being, because it pays just massive dividends when we're talking about patient care, but also obviously ourselves, our relationships, our children. So yeah, there's so many reasons to get behind well-being.
It's interesting what you say about the burnout and the depression and how difficult that time was to you, but you also described it as a gift.
Yeah.
There's a guy called Mo Gordat who was at Google X.
Yes.
And
he's really awesome.
he lost his son when he was a teenager, and he has this thing that's called the eraser test, which is you're allowed to change something in your life, but it means if you change that thing, you change everything.
Yeah.
And most people, given the choice, wouldn't change the thing because it means everything that goes forward changes. And without your experience, it might be that we probably wouldn't have the book, you wouldn't have created My Ninja. So as hard as it was, it did give you that opportunity to kind of explore that further. And then in 2019, you set up My Ninja, which is obviously before the book. So what is My Ninja and how does that help the profession?
So My Ninja is my baby. It's a startup, a wellbeing startup specifically for dental professionals. And the vision really is to help increase mental wellbeing for all dental professionals across the globe. And I do this through evidence-based wellbeing education. So whether that's workshops or programs or products, that's what I want to kind of bring to dentistry. And I've been really, really fortunate that I'm able to work as a dentist and also work in this space, really helping dental professionals, like I said, not only reduce negative wellbeing markers like depression and anxiety, but for me, what's really, really exciting is to get them to thriving states and help them to flourish in dentistry and find their happiness. And as a positive psychologist, it's truly it's really meaningful for me to bring that to dentistry. Again, when we talk about mental health, we often talk about mental illness, but there's a whole spectrum, and I'm sure all of you can resonate with times feeling disengaged at work, feeling a sense of loneliness or isolation, or just not feeling very engaged. And so this is where psychological tools and having a very proactive approach can make such a big difference. And so, yeah, been really, really fortunate to start off initially doing wellbeing training. So I'd go into practices and train practices. And then during the pandemic, that shifted to working directly with amazing organisations like Unilever and Action and many kind of public and private sectors, but really kind of helping in terms of creating programs and workshops that were engaging, and that for me really matters. I didn't want to do a boring webinar. It needs to be practical, it needs to resonate, it needs to be interactive, and so I really tried to push my own kind of boundaries in terms of what I can do in the education space, and to think of engaging ways to really bring this and help you apply this with patients and at home. I think that's a really exciting space to be, and I'm quite optimistic about the future. I've seen so much progress. Prior to the pandemic, there was so much resistance talking about mental health, but with the pandemic, things have really opened up, and I think everyone seems to understand and appreciate the importance and value of it. And it makes sense, if you look outside of dentistry, and a lot of organisations are really doubling down on well-being of their staff, and seeing that if you put emphasis on the happiness of teams, then you're going to get more productive teams. You're going to have teams that actually stay and are excited to be at work. And so it does make a lot of sense to really embed this in our cultures at work. And so, yeah, it's a wonderful journey to be part of, and brings me so much meaning. And yeah, I'm excited to see what more comes out of it. I've got a billion ideas of products, and yeah, so it's a wonderful space.
And I think it's brutal, but I think making it work commercially actually matters, because I think lots of people like ideas, but if they can see there's a true business benefit, then I think that takes it to another level. But mental health and well-being, it doesn't really care about your age, your sex, your colour, your creed. There's no rule book that says, oh, well, I'll be okay, but you won't be.
Yeah.
And that, we're fortunate, we've got Tiddy with us. Tiddy's a fourth year student at King's, second degree.
Yes.
But what's your take on it? As somebody relatively new into the profession, what's your take on how it's affecting dentistry and younger people?
Yeah, so I think, as you said, I'm in fourth year at dental school, and even at dental school there's so much pressure going on just to be as good as everyone else around you, and it's often easy to forget we're all learning, we're all new to this, and there's people comparing each other all the time, and things that we're new to doing, like crown preps, all these procedures that we're seeing for the first time. Everyone around you seems to be doing so well, and it's just getting caught in those thinking traps, which you mentioned in your book as well, of having these negative thoughts like, oh, everyone else seems to be doing this so easily, why am I struggling? But it's actually, if we speak about it, we realise that it's not just you're not alone. Everyone's struggling with different things in dental school, and it's just, it's quite a toxic environment if you don't have the chance to break it down and think about what you're doing. So I think Maruk's book is going to be a lifesaver to many people in the dental profession, especially dental students, because we don't really realise what we're stepping into when we go into the career of dentistry. So starting it early from dental school and getting these good positive thoughts into your head is going to be really good.